Super FM.
Your one family, one radio, Super 92.7 FM.
One family, one radio. 92.7 Super FM.
Your one family, one radio, Super 92.7.
If the regulatory agencies get to listen to what I'm saying, I'm soliciting that nobody can create life. Life is very precious, no matter the situation it is. I think I'm able to.
Do you have anything to say just before we go on this quick break? This is Spotlight, by the way, on Super FM 92.7. Be a part of the conversation. What do you have to say? 0805 092 0927. That's 0805 092
FM.
One family.
sitting down and concurring is like, yes, no, yes. But Abiodun, like we were saying off air, it's not even just about police reports now. Sometimes there's an emergency and the hospital will be asking for deposits first, that you must drop advance. Let's say there is an emergency issue in the middle of the night. The patient is there with wounds and you say, drop advance, madam, you must drop advance. And Okay, let's, there are other issues. It's interwoven. There's ATM issues. There's, transfer issues.
Yes,
The
yes.
person is dying. So why not just detain the person in the hospital after first aid treatment? If the money does not come, I don't know, you follow up. Or do you think sometimes too the law has a role to play in this? Probably a lot of people don't feel secure enough to lend a helping hand, people in the medical field. Because it's not everybody, definitely.
Yes, yes.
But then majority.
I think it's like I said while we're on the break. I think it's due to past experiences. Of course, everybody still has some level of humanity in them to show compassion or to show pity, as the case may be. But many times when you speak to some doctors and they tell you how they've rendered such help in the past, and the people simply just disappear without
But
making use
I think there is the code. I'm not a medical doctor, but then there's this code of you have to save
first do no
life
harm.
first.
Yeah, first do no harm. Yes.
So it's like, how would you be waiting for advance before you treat someone?
It's just what it is. But again, I think that still falls down on the government in some way, because if you had access to health insurance, for example, and like many people do in very sane climes or developed countries, this wouldn't come up.
We have the health insurance thing going on,
but not
right?
many people are. Yes, it's still effective, but not many people
I
are.
heard Lagos State has one.
Yes,
Maxwell, are you aware of it?
Yeah,
So
they do.
How effective is the Lagos health insurance scheme? What's
Yeah,
the name
it's
again?
is effective. It's effective. Although I'm not benefiting personally as a
What's the
person,
name
but
of the
people that
insurance
have
scheme
benefited
again?
from it,
Ilera
they
Eco.
really have a good testimony to
Eco.
share.
Okay.
Yes, it's great.
Okay. All right then. So, what is now that we talked about health insurance, just wrap your thoughts up with that. What can be done in that regard? How can it be improved on? Because even when you have health insurance, you go to some hospitals, they don't treat you. They say the insurance people are not giving them money. So they are not, as if that's your business.
If you ask me, accountability in this country is something that which might sound so familiar and so easy, but it's something that we need to really look into. When it comes to health insurance, governments on their own side of it, they try to, as much as possible, to bring in one or two policies, protocols to help situations, but you realize that on the long run, it gets messed up, it gets manipulated, and you will not see a good outcome from it. If we are serious as a nation, I think as of now, we should be able to have a register which have these issues can be linked to.
Hello, Maxwell. Can you hear me, please?
I can hear you.
Okay, just a few seconds.
Well, on the
because we
clock,
need to...
Maxwell.
Please, just wrap up. Can you hear me?
I can hear you.
I said just wrap up the thought just in a few seconds because we need to go now.
Okay.
Yes.
So I think that is all. To wrap it up, as you've requested, I think it's just to appeal to the government to probably have a good accountability process in place in all areas of investment in health sector, infrastructure development, manpower development, supplies, training. And if we have accountability, I think we're able to develop the health sector in Nigeria. Because if you ask me, as we stand right now, the health sector in Nigeria is really deteriorating rapidly, and not just only for the public sector, both for the public and the private, because the private are not finding it so easy due to the fact that the economy is so unstable,
Yes.
and they have to find it difficult able to get things in place and able to manage their resources.
All right.
So the government have to do much to work modalities to have this set up be in good track.
All right.
And
then,
again,
Maxwell,
we have to ask the government to look for a way to ensure they have social insurance system working, that all Nigerians should be duly registered and duly, they will have a good
all right.
health insurance scheme that covers everybody as a Nigerian. And the idea of having the NIN, the BVN should be unified in a way that one single number can be used to track any activity anybody's doing in this country, so we have accountability to everything that we are doing. If my opinion and my suggestion will be duly noted and taken by the authority.
All right.
Thank you so much, Maxwell. We appreciate you. Thank you. Okay, while we try to reconnect with our next guest, who's a medical doctor, this message says, I feel most Nigerian doctors are competent. In bracket, it says, yeah, there may be some a bit less competent, but I feel structural facilities, equipment, patient doctor ratio, that's the burnout, and maybe passion can be an issue too. A doctor basing with quick, a doctor battling with quick notice and other financial problems will give out a very low quality care to his patient or patients as he's distressed. Brain drain must happen. They spend money to study. They need to return on. They need return on investment. Inem. All right, Inem. Thank you so much. I agree. You know, sometimes the passion. If your parents force you to study medicine, that's another issue too. Hello, doctor. Good morning.
Good morning.
Good to have you join us on the program.
Thank you.
All right. So now you've had so I don't know if you've been listening, if you've been following the conversation, Dr. Ajay.
Okay.
We talked about we're looking at the issues the health sector is faced with. Nigeria's healthcare infrastructure, the challenges, and would like to also hear solutions from you. So currently, what are some of the issues you would say the health sector is facing at the moment?
Thank you very much. One of the issues the health sector is facing presently is poor financing and investments in healthcare system in Nigeria. And the challenges has to do with low budget allocation. That is being discovered that the governments of the day do budget and less than 5% of their annual budget for financing health, which have a significant effect on the assessing healthcare in Nigeria. And because of this, apart from low budget allocation, we have inadequate infrastructure. Many of the infrastructure in our hospitals and our healthcare systems has been dilapidated. It's been long, and then there are no maintenance and every other thing to bring them to the standard, to the present standard, because some equipment that have been made or the infrastructure that have made for maybe about 5 million people is now being used by about 200 million. So it's a very big problem. Then, because of this, this has led to brain drain in the system, because every doctor wants to work where things works, where there is a good infrastructure to practice what they've learned in school. And then because of that, people are living to a better system where things works. And another thing in our system is corruption. Even out of the 5%, less than 5% of government is being allotted to assist to the healthcare system, a lot of it is being embezzled. And then corruption is eating deep into the system. That is making it difficult for the little resources being allotted to this to healthcare system. And inefficiency, by the time you put a rand pole in a scare, a rand pole in a scare hole is a difficult thing for you to achieve success. So inefficiency is another factor that is affecting us. And then also another thing that is really affecting the country is inflation. Even when the budget reaches trillions or millions and everything, even before the middle of the year, the inflation has catch up with it, and so the money cannot do anything. And then also it's this issue of most of the things being used in our healthcare system, like drugs, like equipment, is being imported. They are not locally accessible. And this is affecting the system. A lot of things is affecting the system. And these are the reasons why.
Yeah.
And it's having the consequence, the impact on the populace is that many cannot even no longer access good health care. Many have resolved to manage themselves by going to chemists or something, or to even to the alternative medicine. So it's a big problem in the country. Thank you very
All right.
much.
So I'm going to ask you two questions now. Let me get your thoughts on health insurance in Nigeria and also the issue of fake drugs. I believe as a doctor, you would know more about that. Just make of these two questions what you can. Health insurance in Nigeria, the way it's currently run, and the issue of fake drugs.
Yeah, the health insurance in Nigeria is a dilemma that the government or the authorities has to look to seriously, because in a stagnant climate, health insurance has been what majority has been using to assess it. Because in all sincerity, government alone cannot uh, cannot really be the only one to be financing it, and that's why it's always good for people to pull the government and the masses to put together resources in such a way that it can cover for the health financing. But as far as this country is concerned, Nigeria is concerned, is health insurance is still very, very low. People are not buying into it, even though maybe the government also are not doing the best, or maybe because of insecurity, lack of trust. Because even when government brings those policies, how many people wants to key into it? Considering the fact that a lot of things have happened in the past and people lost their money into the process. As long as there are not check and balances, there's no good justice system that can make people to be accountable. Then it will be difficult for people to buy into such policy. But the point is that NHS will have been a very good thing if our government had been sincere. But as far as Nigeria is concerned, I think it's still poorly implemented. If at all they are trying to implement it, it's something that they need to buy into the conscience and the conscience of people that is doing the right thing. Because corruption is making everybody to, even if they are bringing it, not to talk to the fact that many of our government are not even buying into it. But even if they are buying into it, the issue of corruption is making the populace even not so get involved. Even look at pension and everything. So what are we getting out of it? It's just charm. So, the issue of fake drugs, yes, when there are lots of lapses in the system, and like I said, accountability, and even the government agencies that should look into all these things are corrupt. So it makes a lot of things to fester in the land, and that's why a lot of drugs are fake, because there's no regulation, there's no even the policies. Anybody can just go to India or Pakistan to formulate drugs and move it to the market. Nobody's to check them, and because of that, there are a lot of fake drugs in the land. Thank you.
All right. Before Bjorn's going to ask a question soon. But now, would you say that some of the issues bedeviling the education sector is affecting the quality of the doctors we are having today and tomorrow? Some of the issues like strike, poor funding, there are allegations of lecturers being negligent, and I think a medical student was recently caught with ESPO. I don't know if you saw the viral video. But now, some of those issues, would you say that it's affecting the quality of new medical doctors? Upcoming medical doctors?
Definitely. The health system or the no department or no agency is an island on its own. Whatever is happening in the land, in the system as a whole, will definitely affect every arms of every agencies of government. Yes, definitely. If there are strikes, there is no continuity and everything, there is no way that you can't compare it with a system where things works. A student that is being caught trying to cheat during the exam or everything, it's just not because the student, as much as I'm not saying that the person have done a lot, have done a good thing, but the system itself is affecting a lot of things. It's affecting, if the educational system is not working, strike today, everything. There's no way, as long as there are breaks in between, and the students, they don't even know what the future holds and everything. Even to put in their best even into their studies is making it difficult. So it's really affecting it, and that's why today you see some newly graduates and a new graduate of medical schools. They talk, when they practice, we found out that things, the decadence of the society have invaded the educational system, which is affecting the product that's coming out of our higher institutions. It's general something. It's not even about medical school. It's about both engineering, social sciences, and everything. All this has a significant effect on the product of all these higher institutions. Thank you.
All right.
All right, Dr. Ajayi, just before you came on, we're asking Maxwell about the attitude of healthcare workers, and Kimberly was particularly focused on the nurses, the matrons, and all of that. I know, of course, you work in a healthcare setting and you also interact with doctors in their hundreds. What would you say is responsible for this attitude? Would we blame the government in this case, or would you say because there's a lack of motivation or because of low pay? What exactly is responsible for the way some of the healthcare workers, especially those who are nurses and matrons and midwives, treat pregnant women and some other patients and talk to them very rudely and all of that? Why? What is the cause of all of this?
Thank you very much, sir. The point is that it's a multifactorial issue in the sense that, yes, there are people that are naturally lazy and there are people that are naturally not well cultured. But should I tell you that the most important is that it is what you give into the system that the system give back to you. If by the time you, for instance, in Ogun State, we were on strike for the month of August. Throughout the month of August, at the end of the day, we came out of that strike. What pushed us to the strike is remuneration, disparities, and we came out of it. We promised that the government is going to do something or the other. Until now, because the strike was suspended for 1 month, and the 1 month is running out of something, and yet nothing happened. What even if we consider the populace and okay, let's continue working? Are you telling me that we should all know that the system, or no doctor or the health workers want to perform, will be able to perform even when they want to perform. They will be able to perform the utmost level because they are not an island. They cannot be isolated from the system. They buy fuel, they get through bad roads, they go through strikes. Even before getting to work, they already stressed up. Their emotion has already been battered. And the same kind of people, we want to get the best out of them when they get to work. No. That does not mean to say that some people are not naturally lazy or they are not they are arrogant. Yes, but majority, what affects them is what is happening in the system. And because of these factors, there's no way you can get the best out of our health workers, which is normal.
All right.
It is absolutely normal.
Okay.
Thank you, sir.
Now, Dr. Jai, in what ways would you say the government can better prioritize healthcare in the national budget? And, what trade-offs do you think might be necessary?
Well, the most important thing is that we should start with the sincerity of our government. One thing I've discovered within the short period I've been at the helm of affairs that in my state is that even though the budget allocation to health might even be from the planning, even the amount allotted for health are almost very small. But even the one that even allotted, are they even implementing it? That's another question. The point is that most of the time, what they even give to it, most of the time they don't implement it to the letter. And so the best way for the government is that they should increase budget allocation to health financing, and the little or whatever they are giving should be implemented. And by using an efficient office authorities, because one thing that is for you to put the person that does not know what things at these levels, this system, to come and oversee the affairs of the system, it will be a problem for him or her to implement things properly. So they should put a round pole in a round hole so that things can work. And then because there should be a way to prevent the leaking in the system. Corruption are sitting to the fabrics of the system, but there are ways they can do it, and the best way is that our justice system must be fortified to do what they are being paid for. You discover that many money, many allocation, many resources are being wasted away, and apart from being wasted, are being embezzled along the line. And these are the problems that the masses will face by not getting access to adequate and effective and efficient healthcare system. Thank you, sir.
Okay, this might be a little out of context, but I think it's also, all parts of the issues in medical. I currently know a doctor that is upset with the fact that he studied medicine He wanted to be an engineer, but then, the parents forced him. So now let's get your thoughts on the role of families when it comes to, how it adds up to the quality of doctors that we end up having. Because do you think passion has a role to play as well? The enthusiasm to become a doctor? Yeah.
Definitely, passions has a role to play in anything you choose to do, not only in medicine. In every work, there must be this passion that's seconding. Even medicine generally is seconding. And you must, because if you don't be the doctor as if you are doing a profession, there might be a tendency that you might not be able to give your best, because especially in this part of the world where your effort is not being compensated for at least appropriately. But passion goes a long way to affect, at least to make you paddle the canoe, even in the in a water that is in a situation where you are not comfortable. But when you have the passion for whatever you are doing, you definitely be able to have one thing at the back of your mind. That's fulfillment, which goes beyond financial fulfillment. And so many people that find themselves in a profession, in a discipline where where they do not have passion for, even when they have the money, they still find out that they are not being fulfilled. And so fulfillment is part of the things that makes you do your work the way you should do it, even above the way you should do it. Thank you very much.
All right, so the way forward, your final thoughts on the program. What policies would be effective to reverse the, doctors' brain drain, doctors leaving the country, poor financing? What are the solutions? Some, I know you've gone over, tackling corruption, but what are some loose ends that should be tied?
Policy making of our government is very germane. Like the National Health Insurance Scheme should be brought up and in such a way that people will key into it, because a lot of Nigerians are not even aware that there's something like insurance where they can key into. Number one. Number two is that they should more private practice. There is what we call public-private practice in such a way that private people could bring in money into the system to finance the health system, in which policy should be made to guide their business, their investment, because nobody wants to bring in money to a system where there is no policy that is going to protect them in order to invest into the healthcare finance, because it's a very, very, very grant for you to invest and get back your money. But because there are no policy, there are no regulations, which the only people that can do this is the authorities, the government, that can protect this kind of business. So I think it's a very important. There's security. Nobody wants to come and invest where there is insecurity. You are not sure of what is going to happen to your business entire. So nobody is ready to come and invest billions into such a system. So there are a lot of factors that government should look into and make people to have this kind of understanding and belief and trust in order to invest, because government cannot do it alone. That's the obvious truth. Government cannot do it alone. There are a lot of the resources available, as a lot of things that is competing for it, which education, security, and everything. The government should give a kind of grant for people for private sectors to invest into it. Thank you very much, sir.
All right, thank you so much. Thank you for coming on the program, Dr. Ajayi Abiodun. Thank you. We appreciate you, Chairman, National Association of Government, General Medical and Dental Practitioners, Ogun State. Before him, we had Maxwell Ibadan, who's a diagnostic health consultant. So, Abiodun, we've had we've been talking about this so far. What are your thoughts?
Very interesting. I'm glad that the two guests who are, of course, very accomplished medical practitioners have made some important points about not just the problems, about the potential solutions. So, but I still have a bit of fear, like you referenced, the brain drain that we're seeing. I think that we're going to get to a point in this country where people will resort to telemedicine. By that I mean that, so your doctor, who is maybe a specialist or consultant, who is now in the UK or in Saudi Arabia or in Canada, USA, you would have to consult with them via the phone, because every time you walk into an health facility, you get the news that this doctor just traveled, this pharmacist just traveled. And of course, it's because of the system, like Dr. Abiodun kept emphasizing, the system, which is sad. So what's the fate of people who cannot, afford to pay for expensive healthcare, just like you referenced the other time, who have to, stay in government institutions, government hospitals, and every time you go there, there's always a case of this doctor has left, this nurse left, and traveled the other day, traveled last week, traveled last month, which is sad. Again, health insurance to the rescue, but many more people need to be informed
the
about
health
this.
insurance, there are a lot of issues
Is
there,
it-
Biodun.
Yes,
Have you
a
tried
whole lot.
using it before?
Well,
When you
I
go to
had
the
access to
hospitals, they don't
I had
treat you.
access to it while I was an undergraduate because I attended the
No, what
Federal
I'm saying
University.
is when you go to the hospitals,
Yes.
most of the hospitals, they don't treat you.
Yes, yes.
It's a case of, we're not getting the money back.
Yes, even for private health insurance. Yes, I had
private-
some
okay,
experience with
I
that.
haven't tried government.
Yeah, for
insurance
government, I
before,
think
but I heard the
it's
Lagos
almost
one
the
is
same.
pretty
Yeah,
effective.
very much
I've
effective.
been hearing a lot of
Yeah,
positive.
especially for maternity cases, the Ilera Eco,
Yes,
very, very
yes.
effective.
So I think other state governors should emulate it beyond the federal,
Yes,
insurance
exactly.
scheme. Other state governors should, come up with it. If we're getting the positive feedbacks of Lagos insurance,
Yes.
health insurance.
Those are examples that you expect that they can copy.
All right, and thank you for being a part of this. You're listening on the other end of the radio. It's been Spotlight on Super FM 92.7. We'll be back here again tomorrow. Edo in focus. The election coming up on Saturday, and we'll have some analysts to go over everything we're expecting from that end tomorrow. I am Kimberly Ubiabo. Abiodun, thank you so much.
Thank you. See you tomorrow.
Enjoy the rest of your day. Bye.
One family. One radio. 92.7 Super FM.
Your one family, one radio, Super 92.7 FM.
One family. One radio.